My name is Declan Gilchrist. I work in a 5-vet mixed practice based in Dungarvan in County Waterford. We cover a radius of about 20 kilometres around the Dungarvan area. We would be 50-50 really large and small, and out of our large animal practice we would be 80% dairy. And we've definitely seen an increase in that in the dairy area in the last, say, 8 to 10 years. What we find as well, at this time of the year, it's a really good time. Farmers tend to be not overly busy. It's a good time to sit down with your vet and go through, I suppose, the year to date, things that have come up, different diseases, and things that happened and how to prevent them from happening again. Especially vaccination protocols. It can be difficult to keep on top of vaccinations because it sounds easy when you're told in a burst of information, but it's good to sit down, talk to your vet, A4 piece of paper, keep it really simple, just a simple protocol. Vaccinations, dosing, all the routine husbandry that needs to be done after the year. For this time of the year, one of the key diseases that we tend to see outbreaks in would be salmonellosis, especially in herds that aren't vaccinated. Typical scenario would be a farmer would ring, would find an animal that had lost its calf. We would start doing some blood samples, some investigations, and it tends to be a storm type scenario where you really are chasing your tail and you've lost the initiative really. In those situations, salmonella is probably the most common cause at this time of year, especially of animals to abort and lose their calves. So it's really important that if you haven't been doing it, that you certainly sit down with your vet now, discuss the risk factors, what you're doing right, what you're doing wrong, and I suppose to come up with an appropriate protocol for salmonella on your farm. A lot of the time we see in outbreaks of salmonella, people often can't understand how they've gotten it. They're usually pretty good operators, places are clean, and they still had an outbreak of salmonella. So I suppose it's important to remember that just because you haven't had it before does not mean you're protected, because wildlife can bring it in, buying in animals, movement of vehicles, people, literally anything can transport salmonella into a farm. And without the safety net of a salmonella vaccine, you really are running the risk of a storm or an outbreak at any stage of the year. Key groups to protect are your pregnant animals, which would be your heifers and your adult cows, obviously. We recommend that you do every animal on the farm. It's a 2-shot protocol, 3 weeks apart. It's a pretty easy, simple 5 ml injection under the skin, and protection will be provided for 12 months after the second shot. So it's very easy to do, and we would often combine it with another job, like a dose perhaps, a TB test, something routine, just to make it a little bit easier on the farmer when doing it. One of the reasons we would recommend to try and go in with the vaccine in September, October is because it usually coincides with the last third of the pregnancy, which is when we see most of the pregnancy losses due to salmonella. And also it stops the bottleneck of vaccines that are required at the end of the year and the start of the following year, when you really are going in a little bit too late. So another very important point to make about salmonella is that it's a zoonosis, which basically means that it can be transferred between animals to people. It's not a pleasant disease. It can lead to cramps, nausea, vomiting, hospitalization in severe cases. So it really does copper fasten the need for have a proper vaccination protocol in place to protect both animals and yourself and your family.